Hi, good morning, Colin. My name is Isabel Davis. I'm your invigilator for the OET speaking session conducting on the 16th of January 2020. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Can you say your full name for the record, please?
My full name is Colin Smith.
And what is your candidate number, please?
My candidate number is 233267532.
Thank you. And you are taking this test as a nurse? Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
What do you find most pleasing about being a nurse?
According to me, what I find most rewarding about nursing is something like seeing a person standing at his or her own feet after getting recovered from major surgery, or helping patients and their families with the most important issues is rewarding for me.
Name some skills that are mandatory for a nurse in order to be successful in his or her career.
Apart from technical skills, a nurse needs some special soft skills, which are teamwork, communication, listening and understanding skills, empathy, organizational skills, patience and hard work, etc.
How do you use organizational skills in your daily responsibilities as a nurse?
Being a nurse, I'm enrolled with various responsibilities, and my job demands to be organized. To keep a tab on all duties, I create a checklist for things to do, and tick them off as I complete the task accordingly. The tools that I need to handle, I keep them organized as well, so that I can carry them easily when I need one.
What's your strongest skill as a nurse?
My strongest skill is to make aware of some do's and don'ts to our patients. It is somewhere mandatory because patient education is a must, which should be followed accurately. And I find myself reliable for performing well on this task. I consider evaluating things around with the same patient case by showing some video case studies about patients just like him or her who changed their routines. Through this way, it can be easy for both of us to deal with the situation efficiently.
How do you react in stressful situations?
The most important thing to do in a stressful situation is not to become nervous and react inappropriately. At this point in time, the best approach is not to think about demands too much. Instead, keep doing tasks one by one, as fast as you can. I try to remind myself about how central my job is, and continue with my work with a positive attitude.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hi. My name is Colin Smith, one of the nurses in the emergency department. Am I talking to Julia's mother?
Yes. I am her mother.
How may I address you?
My name is Isabel Davis.
Well, Isabel, can you brief me about the accident, please?
Yes, sure. Julia fell from a tree, which she was climbing with her friend.
All right, could you please explain to me what happened after fall?
Suddenly, she was knocked unconscious. When she regained consciousness, she vomited. Also, I noticed her pupils were dilated and seemed unequal. I rushed to the hospital in no time. Nurse, she is my only child. I'm the sole parent as well. Help us.
Please relax, Isabel. I understand how stressed you will be. Stay calm and strong. You should be very optimistic in this situation. Don't worry, we are here to help her.
Yes, nurse. I will. And, how is she now?
Isabel, listen to me carefully. Don't panic. The doctor has ordered a CT scan and x-rays immediately. We are suspecting a skull fracture for her.
Oh no. A skull fracture. Oh, my daughter.
Relax, Isabel. Calm down. Nothing wrong will happen. We are providing her the best treatment possible, with utmost care. I assure you that she will be all right.
Nurse, I am scared.
I acknowledge your emotion, Isabel. May I know the exact concern, why you are scared?
I am scared about Julia having brain damage.
We cannot determine brain damage right now. Skull fracture is also not confirmed in this situation. The doctor has ordered a CT scan and x-rays for a better understanding of her injury. Is it clear to you, Isabel?
Yes, nurse. I got it.
Isabel, do not give up your confidence. Be courageous. Your daughter will be all right.
Thank you for your support, nurse. Your words are truly appreciable. Nurse, if you don't mind, let me stay with my daughter, please. That may make her more comfortable.
I am really sorry, Isabel. Our hospital policies will not allow you to be inside the emergency department.
If I can stay with my daughter, it will be a great support to her as well. Also, I could immediately know what is happening to her.
Your thought is really reasonable. However, why we insist you wait here in the waiting room, rather than to be with the daughter inside the emergency department is that you may not be able to control your emotions as you think. Also, the emergency department is the place where things have to be done very quickly, like every second count. There will be several patients seeking various medical aids that a parent in your situation could not be able to witness. I hope I am clear to you.
Yes, nurse. I understand. It's okay. I will wait here.
Thank you for your understanding. Do you have any other concerns that I have to address, Isabel?
Yes, please let me know about my daughter's injury at the earliest.
Isabel, your curiosity is appreciable. The results won't be known until the doctor meets you at the time you have been called. It is because the doctor is the person who evaluates the patient's diagnosis report and decides the treatment options possible. The doctor will not delay it. You will be called immediately, once the diagnosis results are with him. Your daughter's current situation, treatment options, and procedures will be discussed in detail with you. I hope you can follow my words.
All right, nurse. You are clear to me.
We have no time to waste. We should proceed fast.
Sure, nurse. Please proceed with the necessary steps. And save my daughter.
Stay calm and be optimistic. I assure you that your daughter will be all right.
Thank you for your support, nurse.
It's my pleasure, Isabel.
That is the end of your OIT speaking role play. All the very best.
Thank you.
Thank you for watching. Please like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.